factors modifying drug action. Variation in response to the same dose of a drug between patients and even in the same patient on different occasions is a rule rather than exception. A multitude of factors influence drug response. These factors and their understanding can guide choice of appropriate drug and dose for an individual patient. Some of the factors that modify drug action are discussed below. The first factor is body size. Body size influences the concentration of drug attained at the site of action. The dose that is given normally corresponds to the adult of medium build. In extreme cases of low weight or higher weight, dose to be actually calculated based on the per kilogram dose. It has been argued that body surface area provides a more accurate basis for dose calculation. It is used in calculation of dose for anti-cancer drugs. The body surface area can be calculated from the body weight using a formula K into body weight in grams power 2 by 3 into 10 power minus 4. The value of K is a constant which varies for species. Age is another factor. Drug behavior differs in infants and children, which are characterized by low glomerular filtration rate, higher permeability of blood-brain barrier, and poorer absorption. In the old animals also, poor metabolizing capacity, low plasma protein binding, and slower absorption brings about a need for alteration of dose. Sex or gender is also an important factor to be considered. Females of any species are generally smaller in size and may need lower dose. In the female, pregnancy-induced changes such as delayed absorption, fall of plasma albumin, increase in acid glycoprotein, increase in renal blood flow, induction of cytochrome P450 enzymes, all these changes modulate the pharmacokinetics of a drug. Besides, in lactating animals and in pregnant animals, the possibility of drug affecting the young ones or the fetus ought to be considered. Species as a factor. It has already been discussed that many species differ in the way they metabolize drugs. Dogs are poor astylators, cats are deficient in glucuronidation. When drugs are administered, these factors are to be considered. Diet and plane of nutrition as a factor. Animals produce predictable drug response in good plane of nutrition. The drug response may vary or may not be suitable or may not be appropriate in poor or malnourished animals. Genetic factor. In certain individuals, in the human beings, the deficiency of glucose 6-phosphate dehydrogenase has been shown to be an important factor which causes hemolysis with primaquine and other oxidizing drugs. Malignant hyperthermia has been observed after halothane administration in some humans and in pigs. Continuing our discussion on factors modifying drug action. The next factor is route of administration. Route of administration governs the speed and intensity of drug response. It is possible that a drug may have entirely different uses through different routes. Example is magnesium sulfate. Magnesium sulfate, when given orally, causes purgative action. When applied topically on inflamed areas, it decreases swelling. On intravenous administration, it produces CNS depression and hypotension. The next factor is environment. Exposure to insecticides, tobacco smoke can induce metabolism in individuals and therefore modify drug behavior. It is well known that hypnotic drugs which are used to induce sleep work better when taken at night time. The next factor is psychological factor, which works more in human beings. The beliefs, attitudes and expectations of individuals may modulate the way a drug behaves. It has been well established that placebos, which are pharmacologically inert substances given in the garb of a medicine, are used in trials and can be used to treat patients who are otherwise normal. Placebos have been shown to induce endorphins in brain and cause analgesia and a feeling of goodness. The next factor modifying drug action is the diseases. Pre-existing or underlying diseases of the GI tract or the liver or the kidney modify the action of drugs in terms of their absorption, biotransformation or the excretion. In all the above scenario, a change of dose of the drug may be required. The next factor is immunity. Immunocompetence of individuals is normally good in adults but may be compromised in very young or very old patients. While treating infectious conditions in immunocompromised patients, it may be suitable to replace bacteriostatic drugs with bactericidal drugs. Drug interaction. Hardly any drug therapy is undertaken individually. Most often, drugs are usually given in combination therapy. It is always prudent to anticipate any potential interaction among different drugs given to the same patient at the same time. The interactions may be beneficial or the interactions may be harmful. Some of the beneficial interactions are the use of epinephrine with local anesthetics, pre-anesthetics with anesthetics, and combination of antibacterials. Some of the harmful interactions include use of neuromuscular blocking agents with aminoglycosides. It is also necessary to understand the potential interaction of drugs with the food. Normally, presence of food delays drug absorption. Some of the specific ingredients of food have been found to cause specific drug interactions which may be beneficial or harmful to the animal.